My name is Dr. O.C. Nzewi, a consultant cardiothoracic surgeon. What does operation involve? Two things. First, we need to harvest what is called a conduit. We usually take a vein from the leg, and then inside the chest there is an arterial conduit called internal mammary artery. We harvest it. So patient is put to sleep, we open the chest, harvest the conduit from the leg, and then the operation starts. This operation we can do by two means. We can actually do it on a beating heart, which is a more complex and technically challenging. But traditionally in Nigeria here, I do all the operation except few using what's called a heart-lung machine. This machine is so sophisticated and it has to be operated by a special, well-trained person called a perfusionist. What does it do? For us to do the operation on the heart, we will divert all the blood coming to the heart into this machine, and this machine will now oxygenate it, in other words, and then pump it again back into the aorta, which is the main pipe that supplies all the body. Once we've established that, we can now shut off the blood going to the heart completely and use a special drug called cardioplegia to arrest the heart. In other words, we stop the heart beating, and that gives us an excellent motionless field to bypass the area of obstruction and then connect it to the ascending aorta. Once that is done, we now have a pipe taking a fresh blood from the aorta, or an arterial supply coming up the aorta, and bypass the obstruction. Having done that, you now allow blood to go back to the heart, wash out all that chemical that stopped the heart beating, and the heart starts beating again, and the anesthetist now starts giving oxygen back again to the lungs, and then the heart gradually take over the function again from the machine. And we would reverse all the drugs that we gave, and then that's the operation finished. Most of them will be asking, is the operation done? Is it all over? And what they thought that they are not going to survive, they'll be smiling, and that gives me a tremendous joy to see that happen. What's the risk to the patient? We use a special calculator called Euroscore, which is essentially, you put in all the patient's problems, morbidity, other diseases. It will be able to estimate the operative mortality. So we call it Euroscore, and we score it, we give the patient. But in actual fact, unless the patient is extremely very sick and is an emergency operation, salvage, he cannot do anything until rushing to theater. If it's an elective operation, for anybody, even if up to 80 years of age, in my hands, the operating mortality for this case is less than 2%. In other words, if you operate 100 people, 98 will survive. So the basic thing is that the operation is very successful, and the chances of dying during the operation is very small, and it has remained so here. And what's the recovery? They stay in ICU for a couple of days, and then all the monitoring lines come out and they move to the ward, and some of them has gone home on day 5, most of them. Full recovery takes up to, full recovery up to the stage where you now tell them, return back to whatever you were doing. It takes about 4 to 6 weeks. But by the time they are home, the second week of their activity in their home, they should be able to walk up to 3-4 miles a day. And their pain usually goes away within 2 or 3 weeks. The wound heals perfectly okay, majority of the patient without problem, including the leg wound. So the operation is a standardized operation with predictable outcome, which is to take care of the chest pain and prevent the patient from further catastrophic heart attack.